Rock climbing, the art of throwing our bodies on a wall and hoping to climb our way to the top. Over the last decade, the sport has seen a major increase of climbers all over the world, and its popularity has skyrocketed since its debut at the Tokyo 2020 Summer Olympics. To excel at the sport, climbers train specific muscle groups in their hands and arms to catch holds, hang upside down, contort their bodies, and do whatever means necessary to propel them up the wall. As the climbs become more difficult, so do the handholds. Tiny holds demand immense finger strength, but there are no muscles in our fingers to help us grip. So, how do climbers grip onto these smaller holds? Today, we're going to look at our hand anatomy to help us understand how the muscles in our hands work, how we can train them correctly to improve finger strength and prevent injury. The bones of our hands are separated into three anatomical regions: the wrist, which consists of the carpal bones, the palm, which consists of metacarpal bones, and the fingers have phalanges, which are further subdivided into the proximal, middle, and distal phalanges. The thumb is unique in that it does not have a middle phalanx. Within our hands, we have different sets of muscles that attach to these bones, and when contracted, they pull our fingers and palms into all sorts of configurations. The dorsal interosseous muscles abduct or pull fingers away from each other. The palmar interosseous does the exact opposite, where it adducts or pulls the fingers back together. The lumbricals run right up the palms of our hands and bring the fingers down at about 90 degrees as it flexes between the metacarpals and proximal phalanx. Fingers are powered by two flexor muscles in the forearm: the flexor digitorum profundus, or FDP, and the flexor digitorum superficialis, or FDS. These muscles help our fingers curl into different gripping positions and allow climbers to hold on. They have flexor tendons that run up the arm into each finger, where the FDP ends at the distal phalanx to flex the fingertip, and the FDS ends at the middle phalanx to flex the middle finger joint. These tendons are held and wrapped around the finger bones by bands of ligaments called annular pulleys, called A1, A2, A3, A4, and A5. When the forearm muscles flex, they pull the tendons along the fingers, and that helps to create a lever and pulley system to lift the body. The most common and relaxed grip is called the open grip. For the open grip, the lumbricals and interosseous muscles don't have to work too hard to flex or grip strong, as the climber just momentarily hangs on to larger holds like hooks for hands. But as the holds become smaller, the grip can change into a crimp, where our fingers are pulled back and flexed 90 degrees at the metacarpal joint. The lumbricals are fully engaged to stabilize our hands at this degree of flexion, and the palmar interosseous muscles keep our fingers strongly adducted to stabilize the position even more. The FDP and FDS are also flexing the fingers to maintain the crimp position, but caution should be taken as the annular pulleys are under immense strain as they try to hold the tendons back. In essence, finger strength is a combination of many structures in our hands and forearms working together to stabilize a variety of grip positions. Training your finger strength takes months to years of consistent fingerboarding exercises. This is where the climber hangs from their fingers to encourage the hand and forearm muscles to adapt to the specific load of force. Start training or warming up with open hand grips and work your way up to training the more shallow and difficult grip positions, such as the crimp. Some seasoned climbers may also begin to introduce weights to their fingerboard training once their hand muscles have gotten used to the climber's body weight and the amount of force. If you enjoyed the 3D animations and models used in this video, you can visit my Sketchfab profile to review the hand anatomy we showed you today. Sketchfab is an online platform for users to publish and share their 3D assets for audiences to view in 360 degrees. You can open and compare the different components of the hand and review their relative structures and functions. We've covered a lot of info about our hands and how they work specifically to climbing, but there's so much more to dive into. Stay tuned for our next episode where we cover thumb muscles and pinching.